You're probably one of the about 1/3 of the population who grind their teeth excessively. The condition isn't new. It's been observed since the beginning of mankind, and it's even referred to in the Bible as, quote, gnashing of teeth. The result of bruxing or clenching teeth is slow but sure. It's destruction of the teeth, and eventually, if not stopped, resulting with the need for significant oral rehabilitation. This video discusses various aspects of the alternative treatments for excessive grinding of teeth, the relative costs of the treatment, and what happens if you do nothing. Bruxing and clenching of your teeth are abnormal, frequent grinding of the upper and lower teeth together, and they cause significant tooth destruction. It's been estimated that in normal eating, your teeth contact only about 4 minutes per day. However, a bruxer or a clencher may have his or her teeth together in a grinding position up to 6 or 8 hours a day. Most of this time is, of course, during sleeping. You're observing a typical tooth anatomy of a person about 30 years of age and another similar age patient, a bruxer, who grinds his teeth constantly, moving the lower jaw forward and back, right and left, while they're in contact. Note how the teeth have been worn flat without sharp cusps. This wear will continue unless treatment is initiated. You're now observing the typical tooth anatomy of a person about 30 years of age and another patient, a clencher, who closes his teeth together and constantly moves the lower jaw very slightly forward and back and very slightly right and left, using extreme biting forces. The muscles just bulge on the side of his face. Note how the teeth are worn to sharp points. This wear will continue unless treatment is initiated. Although some young children grind their teeth, most of them naturally overcome this habit as the permanent teeth erupt. However, excessive adult tooth grinding can be diagnosed as early as the late teenage years. You have only a few treatment alternatives for bruxism and clenching, depending on the stage of your tooth grinding habit. These conditions become more obvious as the teeth wear. The treatment alternatives are a plastic bite guard to reduce your ability to make contact with the upper and lower teeth. This treatment may be necessary at all stages of bruxism and clenching. Bite equilibration to reduce the tendency to grind your teeth as you feel irregularities on the teeth when they contact. This alternative is necessary only when natural teeth or crowns remain as the chewing surfaces. Restoration of all the teeth with fixed or removable appliances, such as crowns or bridges or dentures. This alternative is necessary only in the most extreme bruxism and clenching cases. If you elect to do nothing about treatment for your bruxism or clenching habit, it'll continue until you're forced to have some treatment due to the pain or the inadequate chewing effectiveness or the loss of teeth or degeneration of your appearance. It's very important to you that after watching this video, you select some form of treatment as soon as possible to prevent further wear and breakdown of your dentition. The outside of the teeth, the enamel, is the hardest and most wear-resistant substance in the body. The dentin is located about 1/16 of an inch under the enamel. If something is placed between the upper and lower jaws that is softer than the enamel, that substance wears instead of the enamel. You're observing a bite splint made of plastic. When placed in the mouth, at the times when excessive tooth wear is most likely, which is during sleeping, and in times of psychological stress, the bite splint wears, as you would think, instead of the teeth. Most patients quickly become accustomed to wearing a splint. Of course, you must be conscientious about wearing the splints. Splints serve for several years and must be replaced. However, the teeth remain relatively unworn. Bite splints are the most conservative treatment of choice for initial bruxism and clenching, or one of the several treatments for more advanced cases. I'm sure that you have had to have the tires balanced on your car at one time or another. What if you didn't take the time to have them balanced? Would they solve the problem themselves? I doubt it. The teeth are similar. If your upper and lower jaw are not coming together in an equal manner, you are subconsciously influenced to grind until the offending spot is gone. Bite equilibration, or slight removal of carefully determined, prematurely contacting tooth structure, is often necessary to reduce the tendency that you will have to grind your teeth. This procedure is not harmful since it's so minimal. A typical custom bite splint is made for you after this tooth equilibration. If the bruxism or clenching habit is discovered before major tooth destruction has taken place, only some of the teeth are worn to the level that they need to be repaired. After the affected teeth have been equilibrated and restored, an occlusal splint, plastic splint, is made for nighttime wear and for times of stress. This type of treatment for bruxism and clenching is intermediate in complexity and cost. It should be considered if at all possible. Don't go all the way. You can always do mouthful of crowns that we're going on to in a minute. Stay intermediate if you can. However, there are times when tooth destruction has gone so far that conservative or intermediate level therapy is not possible and comprehensive treatment is necessary. Let's look at it. When extreme bruxism or clenching has taken place, extensive treatment is necessary. The 40-year-old patient you're observing required crowns or caps on all of his teeth, followed by placement of a bite splint. The bite splint, of course, avoids further wear and breakdown after the crowns have been placed. Your dentist will tell you what level of tooth wear is present in your mouth and explain this complex procedure further. Occasionally, tooth destruction caused by bruxism and clenching has progressed so far that the only treatment possible is tooth extraction and placement of dentures. This patient has worn his teeth so far that one of his treatment choices is complete or maybe partial dentures. This patient has very little tooth structure left and must decide between tooth extraction and dentures or extensive and, by the way, expensive rehabilitation with crowns. Fortunately, most cases don't progress as far as the cases you just observed. If you have had severe tooth wear and you need dentures, don't worry. Although tooth extraction usually is not the preferred choice, the procedure has been successfully accepted by millions of patients. The relative cost of treatment for the various levels of treatment is, well, the lowest cost is just a bite splint alone. Moderate cost is the bite equilibration and the bite splint. Moderate to high cost is the bite equilibration, some restorations, and finally a bite splint. And moderate to high cost is extraction of the teeth and complete or partial dentures. And then the final highest one is a full mouth rehabilitation, lots of crowns and bridges, maybe implants, followed by a bite splint. Bruxism and clenching, both of which cause irreversible tooth wear, are serious conditions. They will not stop by themselves. These conditions require immediate professional treatment to stop the tooth destruction at the stage where it is discovered. Please talk to your dentist to determine what treatment is best for your specific abnormal tooth wear pattern, and if I were you, I'd do it